Hello, and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, I have with me Paula Bell. She is the new CEO of West Tennessee Healthcare, Henry County Hospital. Welcome to the show, Paula.
Thank you. Appreciate you having me.
Great, yes. So you just recently became the CEO, and we've been interviewing with a few people around the Henry County area and different areas, so we're glad to get to talk to you as the head and get to know a little bit more about what's going on up there. But for introductions, I just want to go ahead and start from the beginning with your roots. So tell us a little bit about your background and what it means to you to be from Henry County.
Sure. I was born in Paris. I was actually born in this hospital.
Oh, wow.
Several decades ago. So Henry County has always been near and dear to my heart, to my family's heart. My parents owned an independent drugstore here called Watson's Pharmacy. It's not here anymore. My husband's family is from here as well, and they used to own a business. And after I played a lot of golf growing up, was successful at that. Always had the backing from Henry County to allow me to do that.
Right.
I had support locally when I was successful there, and then played in college. And then after playing in college, I had the support of the community to go play professionally. And so this town has always given and supported me throughout my career choices. And so that always left a lasting impact for me. After I quit playing professional golf, I thought, well, I'll go to pharmacy school. And, it was in my blood. And so ended up going to Memphis, to UT Memphis for pharmacy school there. And my husband and I started dating then, and eventually moved back to Paris. At first, we just really didn't want to. We enjoyed the big city life. And then we had children and decided, I think we'll go home. Both sets of parents were here. We just had our second child, and so we decided to go back to Henry County. We honestly both felt pulled to come back this direction. We felt like there was something that we were supposed to do, a sense of responsibility to the community that had supported both of us our entire life.
Right.
And so, so just kind of by the luck of the draw, got a position here in the pharmacy. There isn't a lot of turnover in the pharmacy department here, and so just really kind of got lucky and made it back here, which is really special. My mom was a pharmacist here. She passed a couple of years ago, so to be able to work here as a legacy, and my uncle was the chief of staff here for a few years and a physician in the community, so it's like a family legacy.
Mm-hmm. I love hearing that you're from there, that you left, and, you and your husband both were from Henry County and ended up coming back. I kind of went through a similar kind of a pull. I moved to Nashville thinking my whole life I wanted to get out of Jackson. And then, when you get older, you're like, I want to be near my family, and especially your roots with Henry County. And you now being the CEO, I think that's very special to have a CEO of the hospital there in a small, tight-knit community, that you didn't just come in from somewhere else, that this has been your whole life. So I think that's a very special thing that not a lot of companies have.
Right. And there was a lot of feedback that I have received, at the beginning, during the interview process, and after being named the CEO, and even still on a fairly regular basis, each day, I hear people in the community tell me, like, we're just really glad that it's somebody from here that we know is committed to the community and really has our best interest at heart.
Exactly.
So it's comforting to hear the positive words during this transition, because some days are easier than others, but we're getting through it for sure.
Oh, for sure. Yeah. Going from that. So I kind of want to touch on that a little bit. So what was your journey like from the pharmacy department to becoming the CEO? Did you maybe always have a vision for yourself in a leadership role like this?
To be honest, no. I just never really, I never really expected to be able to have the opportunity to do this.
Yeah.
It wasn't that I didn't feel like I could be a good leader. I feel like I've had those opportunities throughout my
Mm-hmm.
career to do that, but the thought of ever becoming a CEO just never really crossed my mind.
Right.
When we came to Paris, I started an ASHP, it's an American Society of Hospital Pharmacists, a residency program, and it was accredited through the national organization, and we were really training up to 1 to 3 postgraduate residents in the pharmacy department. You know, the medical residency program was starting to be talked about. We had medical students, and the growth in the clinical direction that we were headed was fantastic.
Hmm.
And then COVID hit,
Right.
and everything changed. Programs across the country struggled with having the availability of
Right.
census for students to or residents to really get the experience that they needed. Just because nobody knew what was going on, everybody was restricted to within the pharmacy, and everything just changed so much that that was kind of when I had just become the pharmacy director about a year and a half after COVID hit, and so to kind of go back, I really just always wanted to be clinical. I always wanted to take care of the patient. I felt
Right.
like that was my job. I felt like that was my calling. And so moving into the pharmacy director role, I used to laugh and tell my old boss that was the pharmacy director, I'm like, just as the clinical pharmacist, I just got to take care of the patient. You told me when you didn't like how much money, that drug cost. And like,
Yeah.
hey, there's another option.
Right.
Well, there is. And so you as you become more seasoned. That sounds so
Hmm.
much better than saying as you get older.
Yeah. Yeah. I like that.
But yeah, as we become more seasoned, you start to figure out how to get the same result with a different medication.
Hmm.
What's the most cost effective thing, balancing that for the organization as well as the patient. And so that kind of was a new reality for me when I became the pharmacy director. And so, went through, I believe, about 6 years as a pharmacy director.
Okay.
And then when West Tennessee Healthcare took over, somebody told me one day during the ribbon cutting, they said, they really like to hire from within. If there's a good candidate here, they really like to promote from within, really a family atmosphere. And
Hmm.
that just got the wheels turning for me. Like,
Yeah.
well,
Yeah.
maybe I should consider doing this. And so I eventually threw my name in the hat, and here we are.
Yeah. I love that story. And it's almost kind of like destiny kind of led you here. Just kind of in your
Uh,
story, the way especially, with the pandemic, I feel like in moments like that, you kind of find out who you are. Like, do I want to step up in these situations? And being back in the
right.
community and everything.
Right. Yeah, I had that opportunity. It just kind of fell in my lap
Hmm.
to really be in charge of the COVID vaccine here.
Hmm.
And there was a lot of controversy surrounding the COVID vaccine and just the pandemic in general.
Right.
But just to have that leadership opportunity to take care of the folks that wanted to receive it, some of our best days that we enjoyed the most during really hard times was when we were doing the drive-through pods back here in our nursing home parking lot, giving six, seven
Yeah.
hundred shots. And it was a fun time during a really gloomy era for healthcare.
Yeah.
So but it was during that time where I thought, well, maybe this is what we felt called to come home for.
Yeah. Yeah.
And I think that was just really all part of the process of giving back to a community that has given to me for so long.
Exactly. Yeah. And that's kind of how that sounds like it kind of all worked itself out. Um,
Right.
so I know you mentioned you did golf, prior to getting into pharmacy. So in terms
Mhm.
of back in Henry County, what are some of your favorite things about living and raising a family in this community? And, when you're not at the hospital, what do you enjoy doing in your free time?
The great thing about living here is it doesn't matter where you go, you always see someone you know.
Yeah. Yeah.
You know, sometimes that's great. Other times you just want to be incognito. But the great thing about this town is there's just so many people that we know and know us, and want the best for us, want the best for my kids, and they're always looking out for them. They're looking out for us, and vice versa. I played a little golf when I got back. I don't really play that much anymore right now just because I did it for so long, and injuries, kind of aches and pains of getting old. I'll say old on that one. Really kind of limit some of that just because of wear and tear. But
Yeah.
if I'm not if I'm not at work, you're probably going to find us on a ball field, whether it's
Yeah.
baseball field or a softball field. We are there almost every night of the week, where my son has travel ball, and we're all over the Southeast doing that. So
Awesome. Yeah.
that's what we do.
Yes. And again, yeah, the small community feel, that's such a great thing about Henry County that I've heard from a lot of people that we've interviewed. Now,
Yeah.
in terms of going from the director of pharmacy to the CEO, you know, we touched on this a little bit, but do you have any other insights on kind of how that transition has been so far and what you've learned in these early weeks? How long have how long has this been going on? Like that you officially became the CEO?
I started my first day in the office was the day after Memorial Day.
Okay. And again, I know sometimes it's like time flies and you're like, where did that time go?
Yes. The experience, asking about the experience that shaped me, the most rewarding thing about working here is taking care of people you know.
Hmm.
There's just that added additional interest because you either know that person or somebody in your department knows that
Hmm.
person. Everybody's just interconnected, or their family, or that's somebody you grew up with. That's their mother. The job satisfaction and the responsibility that you feel, and truly the gratification that you get out of taking care of people that you know, is unlike anything I'd ever experienced in my career.
Mm.
Because I worked at the hospitals in Memphis. I worked for Methodist, I worked for Baptist, and it wasn't like that there. I enjoyed my jobs. I had wonderful coworkers, but working here, there's just something different because you take care of people that you have known your entire life. And so I really started to see that and kind of get that feeling when was just one of the clinical pharmacists on the floor.
Hmm.
And then progressing to growing the profession and expanding and doing the residency program, and then becoming the pharmacy director. It allowed me to continue to help educate young pharmacists. It allowed me to work with physicians more, and advanced practice providers, to get the newest, latest, greatest therapy in here for the people of Henry County and
Mm.
surrounding areas, to be able to keep them at home. And so that's what it's all about for me. And that is ultimately why I took the CEO perspective, or what, excuse me, why I took the CEO position. And it was to be able to take care of people in Henry County, to be able to offer the services for them to choose to come to us and receive their health care.
Right. Yeah. And that's something I've noticed with Henry County, that it's such a different ball game from other healthcare systems because it is such a small community and that you know everyone. And yeah, speaking with Linda Burks, the medical student program director, that the medical students that work in the Henry County Hospital, you kind of get to get a little bit of everything because it is so small.
Right.
It's an opportunity to really see all the different aspects of healthcare. And yeah,
Absolutely.
having it on a
It was
more
the same way
personal
for
level.
our residents as well. You had to train them in every aspect of rural
Hmm.
healthcare. It's
Right.
not like, oh, I'm going to just focus on
Focus.
internal medicine or
Right.
infectious disease. It's like, no, you have to do it all.
You're much more
And
well-rounded in those situations, yeah.
yes, sure.
So do you have any top priorities for these first few months as the CEO? And, you know, kind of along with that, what's the kind of culture you're hoping to cultivate within the hospital team?
Yeah, change is hard.
Hmm.
It doesn't matter what setting that you're in.
Right.
And with change comes anxiety.
Hmm.
And I have discovered in the last couple of months, it's the anxiety of the unknown.
Right. Exactly.
Um, not, I truly believe it's not related to anything else. The first couple of months have been kind of really getting caught up to speed on all the things that have been going on as Henry County Medical Center, and transitioning to West Tennessee Healthcare.
Right.
And and also, starting to talk about what service lines do we plan to bring back to the community, or at least hope to bring back to the community. And so, but honestly, right now, my biggest priority is community and our staff here, for them to understand that we are here for the long haul. Behind Jackson Madison County General, we are the next biggest hospital in the system. There are big
Right.
plans for this hospital. This hospital helps Paris and Henry County recruit industry to the area. And so my biggest thing is to try to help calm the anxiety around the unknown, because we are having to build so much infrastructure, and we're still on our old electronic medical record.
Mm-hmm.
And we're going to have to change over to the new electronic medical record. And it's taking so many people to do that.
Right.
But everybody wants to know kind of like what's next, what's going to happen when we change over to Epic. So much of my job, I feel like, is to calm the fear of the unknown at this point.
Right. And I know with Jackson, Madison County General Hospital and the other West Tennessee healthcare hospitals in the community have already switched over to Epic, and that's kind of been kind of a year-long process. And yes, there are a lot of anxieties with the unknown. And we've done a couple podcasts on Epic where, whatever clinic you go to within the system, whatever hospital you go to, Epic will be able to be something that keeps your records all in one place. So we are trying to get the word out on the MyChart app, because that's just a great way for people, like as the patient, you have access to all that, in the app on your phone. And so,
Absolutely.
especially, right now with the transition.
Right. And that's one of the frustrations in the community right now is, well, we're West Tennessee Healthcare. I should be able to come in to our
Right.
health information area and get my records from Jackson. Well, not yet.
Not yet. Right.
Because we couldn't flip that switch. The amount of work that it's going to take to get to that point in June. That's our new date that we're shooting for, June of 2026. Is tremendous. But once we get there, you're exactly right, Carol.
Right.
My chart app and the availability to have your records is going to be like nothing anyone has ever experienced,
it's
unless they've gone to the hospitals.
Right. It's a whole new situation where you've got it in the palm of your hands. I went to West Tennessee Medical Group Clinic, and I got tested for like flu. And before the doctor even came back in, after they had done my swabs, I received a notification on my MyChart app that said it was negative. She came in like 30 seconds later and was like, "You're negative." So that's a really cool thing where, it's at the tip of your fingers.
Right.
And so right. And so in terms of, the transition, kind of the unknowns with that, and you touched a little bit on the things that we're moving forward, trying to, bring back to Henry County. What would you like the people of Henry County to know about you as a leader, and kind of how you plan to help the hospital move forward with meeting those rural community needs?
Sure. This probably sounds a little redundant on my part, but my job, I strongly believe that my job, my role here, is to help the system put into place more services for our community,
Right.
both from an outpatient perspective and an inpatient perspective. Nobody wants to go out of town and be in the hospital and then get discharged and have to turn around and drive back home when they feel terrible. You're only well enough to leave the hospital. You're not well enough to leave the hospital and go back to work. You're not feeling like $1,000,000. And people don't want to travel 2-3 hours or longer to get back home. So my goal is to keep more people in Paris, for people to be cared for here in our hospital. And one of the great things that came out of COVID was telehealth,
Right.
and amazing advancements in that area that is definitely an option for us, and things that we're looking at to be able to really broaden the service lines that we can have here. One thing I hear all the time: can we please bring OB back? Can we have OB back? That is on the horizon for us.
Right.
The timing of that, I'm not 100% sure. Obviously, we can always have hiccups that would delay it. Hopefully, not ever preclude it from being here. But we would really like to see OB come back. It's really important when you look at it from a pharmacist standpoint of an indigent drug program, 340B. That's been in the news a lot, but it really allows you to utilize the 340B services related to your Medicaid population to provide cheaper medical services, cheaper drugs, and it allows you to build other areas of service lines. But I think it's really important that the community understand, for whatever reason, it was the best thing that they felt that they needed to do for themselves, and not a reflection on the folks here. And was with West Tennessee Healthcare. And so it's important that the community understands that we hear their concerns, we hear the anxiety, we hear those questions of, well, where am I going to go for pulmonology? Where am I going to go for other services? Well, I'm not going to know the person that's taking care of me in the hospital. Well, I get that. That's true. It's not the person that you see at Walmart or you go to church with or whatnot. But the bottom line is we're still going to provide good care, and we're still going to take care of our community's our community's needs from a health standpoint.
Right.
That's our goal. We're going to be here for the long haul. So that's when I want to make sure that they understand.
Exactly. And just talking to you, as the leader and from your background, being from there, and, how you've been in the community all your life and come back, having a listening ear to the community and being there and saying, we are listening to you. I think that's very important to have as a CEO of a rural community, especially, when the hospital is under new ownership. So what would you say excites you most about the future of healthcare in Henry County?
Rural healthcare was hard, difficult to stay afloat as an independent community hospital. Obviously, that's why the sign on the door changed. That's why we're West Tennessee Healthcare. But the exciting part for this community is that we are now a part of West Tennessee Healthcare. We have a system behind us that has just about every single service that people would possibly want or possibly need.
Right.
And I truly believe in the next 2 to 3 years, when you look at Henry County, I almost said Henry County Medical Center, but when you look at West Tennessee Healthcare in County, we will have grown so much that I hope that we sit back and think, wow, I can't believe that we were there during the hardest time where we ended up having to sell, unaffiliate with West Tennessee Healthcare, and look at all the services we have now. Look at what
Right.
the system allowed us to do and allowed us to provide for our community. And so I'm excited about what it's going to look like in a couple of years. It's going to be amazing. And I think the community is really going to be excited about what we're doing here.
Absolutely. Yeah. And that is part of the transition. And right here at the beginning, getting to talk to you and getting to know kind of what excites you and what your plans are, just getting the word out to the West Tennessee healthcare community. We're excited, to see where it goes from here. Yeah, with the new resources that Henry County has available through this system. And I know you touched on this a little bit. Are there any other upcoming initiatives or changes you're eager to maybe share with the public?
Sure. I think the biggest one right now is the way healthcare has changed. We used to have the community physicians that saw patients during the day in their clinic, and then they would come in and see their patients in the hospital. And then the whole culture, the whole kind of shape of healthcare changed to a hospitalist system, which is what everybody is familiar with in the last 10 years or so. And that model is going to continue. And with the shifts in the way healthcare is right now, is we have the ability to reach out to different companies that will provide those services for us. And so, we've had hospitalists resign here, and so to recruit local people back, that's very difficult. You can't do it all in one big swoop. And so we've been talking to some different companies that are going to provide physicians for us to be here on site It's going to be the same group that are going to rotate in and out. And so we're going to be able to have that opportunity to get to know these physicians, our patients, and our community members will have the opportunity to get to know these folks who are consistently going to be here taking care of our citizens. And so that's really important to me. Continuity of care. It's important to patients too. They want to see the same people over and over again. And so I'm really excited. Hopefully in the next few weeks, we're going to be able to kind of put more of an official announcement with that. But that is coming.
Right.
And so having that core group and when our other physicians move on to the other chapters of their life that they've chosen to do, we're gonna have folks in here ready to rock and roll and take care of our people.
Right. And yeah, as we wrap up, I'm really glad that we got to have this talk and I got to chat with you and get to know you. And yeah, I think this is a really exciting time, with the initial anxieties here, but a lot of times, anytime something changes, after a while, the dust starts to settle and people get used to the new system. So I'm excited for what Henry County has to offer. And with you as the leader, I'm very glad that I got to meet with you and discuss all the things you have in store. Do you have a message or anything you would like to give to, staff, patients, in the community as you take on this new role?
To our staff, keep doing what you're doing. The sign on the door changed, but the same great people that do their best every day to take care of their patients are still here. And I'm thankful that they are here and they stuck around and that we're all going to continue to work together every day. For our patients and our community members, this is your hospital. We welcome feedback. We know that we're all not perfect and there are things that frustrate folks in the community, but I want to assure them that we are here to take care of our patients and to take care of our community. And we all rely on each other. We need them as much as they need us.
Right.
And so I want them to choose us for their health care and let us take care of them because that's what we all enjoy doing. That's what our passion and our calling is.
Right. Yeah. And having a leader that acknowledges that and is saying, hey, we want to hear from you. That's a very important part of any healthcare system, any company, and especially, with Henry County being such a small, tight-knit group. I think that's really great that they've got you as their CEO.
Thank you, Kara. I appreciate it.
You're welcome. Well, thank you so much, Paula, for coming on. And hopefully in the next few months or so, we get to meet with you again and get to hear some cool things that are coming back out in the Henry County area. We'll be in touch. And thank you again for coming on and talking with me and letting the community get to know a little bit more about you.
All right. Thank you very much. Have a great day.
Thank you. You too. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.